So do you have questions about your dog, but you don't want to go to the vet and pay all that money? Well, you're lucky. Our resident veterinarian and early show correspondent, Dr. Debbye Turner Bell, is here to answer your questions about the dogs. I'm not doing much for your business, am I?
I would have changed that. It's worth every penny to take your dog to the veterinarian.
That is true. But for these kinds of questions, you will do a good job.
I'm going to do my very best.
All right, so we have 5 folks here with their furry friends.
Yes.
Our first owner is Lisa Kerr.
Come on in, Lisa.
And Lisa has a question about her little 2.5-year-old dog. Cute guy.
Yes,
Lisa,
this is Casey.
His name is Casey. And Lisa,
Casey.
what's your question?
So my question is, Casey's been licking and gnawing her paws at night. So do you think it's allergies?
It possibly could be allergies. Unlike with people, when pets have allergies, they don't have itchy eyes and runny nose, they have itchy skin. And one of the manifestations, particularly of inhalant or allergies where they breathe in pollen or mold or fungus, is they'll chew on their paws. That's called atopy. Usually though, if they have allergies, they'll be itchy other places in their inguinal area, their ears, they sometimes get ear infections. So then the question would be to find out whether or not that Casey is chewing because of the allergy, or is there something in the paw that's bothering him. Sometimes arthritis in the joints of the toes can cause them to chew on their feet, and sometimes it's just compulsive behavior. And it becomes a habit for them where they just chew and chew out of boredom. And it's interesting because you said that Casey does it mainly at night.
She does it at night.
And I wonder if that is a compulsive behavior from boredom. So you might want to provide some more toys and some more activity in the evening and see if that helps.
Okay.
Good advice. Let's bring in our next owner and our next dog. We have Elizabeth Powers and her little guy Baxter. Look at this guy.
Yes,
cute.
Baxter. Cute.
So Elizabeth, what is your question?
I was just wondering how much exercise he should be getting.
Now, every puppy does need activity, but they don't need strenuous exercise. What's important to understand is they have what are called open growth plates, and that's where their bones are still growing, and there's cartilage there to allow the bones to do that. If you over-exercise them while those growth plates are still open, you could cause structural damage, skeletal damage to them. Because Baxter here is, you said, a pug and a Chihuahua mix.
Yep.
Both are toy breeds, so that by nature they don't need a lot of strenuous exercise. He just needs to run naturally and play with him naturally, and he'll get the exercise he needs. But don't tire him out. Let him be the judge. When he sits down to rest, let him rest. Don't push him.
All right.
Thank you so much.
Thank you.
Sure.
Our next owner is Jin Lee. He's got Matt in here. And Jin, I'm told you got a question about barking, right?
Yeah, so he's a great little guy, but lately he's started barking at children. I was hoping you can give me some advice on how to stop this behavior.
Yeah, dogs bark is what they do. As we talk, dogs bark. So it's not necessarily a bad behavior, but you want to understand why. Because he's doing it mainly with children, then I wonder if it's not a dominance or a fear or an aggression thing.
Okay.
So it's important that when he does bark, particularly at children, because you don't want this to escalate to biting, you want to distract him. Give him a treat and say, no, sit, and give him a command for a behavior like sit or down or stay. Treat him so that he understands it's okay, I don't have to bark at this child.
Thank you very much.
All right?
Good advice. All right. Coming in next, we're going to move over here so we have a little more space. Because
We got a
some
bigger
big
one over
dogs.
here.
We do. This is Tina and her dog Cooper.
Hi,
and Tina, what's your question?
My question is, Cooper will randomly nip and bite at me, and also chew the sofa, chew clothing, rip apart cushions. What can I do?
What's important here is Cooper's 10 months old. Cooper is effectively in his adolescence, so he's expressing himself. As my grandmother would say, he's smelling himself. All right. So a lot of this is important for you to be very vigilant about obedience training, so he understands that you are in charge of this relationship. Also, he just came through teething, and so some of the nipping and chewing is just as a result of behavior from chewing a lot. So provide him a lot of toys, a lot of puzzles to keep him active, and because he's a retriever, he needs a lot of exercise.
All right. We want to get our last pup in here. This is Denise and Abby. We have to ask a very quick question and a very quick answer.
Okay.
Denise, what's your question?
Hi there.
Hi.
Abby had a lump and I got it checked and they said it was just a fatty tumor. But how often should I continue to have that checked and monitor it?
It's what we call lipomas, and it is a fatty tumor. They're generally benign and they're generally inconsequential. You want to keep an eye on it, make sure it doesn't change in size, color, or character, and have your veterinarian look at it at least once a year. A lot of times with older geriatric dogs, you want them to see them twice a year. So just make sure that you remind the veterinarian to take a look at that lipoma. But it's generally no problem.
Great. Thank you so much.
You're so welcome.
Dr. Debbye, thank you. Thanks to all our owners and especially all the pets.